Today I am here for presenting a topic on CNE from the Medical Surgical Nursing Department. Today's topic of discussion is Raynaud's disease and its management. Okay, so we can see more. So what is the definition of Raynaud's phenomenon? So it is mainly the episodic vasospastic disorder of the small cutaneous arteries, mostly involving the fingers and the toes. Okay, so it can be also, it is mainly defined as the inflammation or a vasospastic disorder of the cutaneous arteries that is mainly due to the constriction of the arterioles. It is mainly named after Maurice Raynaud in 1862, who was a medical student. So there are two types of Raynaud's disease. First one is primary or idiopathic Raynaud's disease, and second one is secondary Raynaud's syndrome. So if it is causing, if not any underlying cause, it is known as primary Raynaud's disease, and if it is causing by any underlying disease such as SLE or any other connective tissue disorders, it is mainly explained as a secondary Raynaud's syndrome. So mainly the risk factors or the epidemiology goes to, it is affecting mainly between the ages of 50 to 40 years of age, and it affects mainly the women age. So that is, the young woman is more affected with Raynaud's disease. So next one we can go to the etiology. So etiology, it is classified as vasospastic or obstructive. So the manifestation of vasospastic, including the patient can feel very much cold. It is mainly increased by the exposure to the cold environment or colder conditions or weathers. When the patient is, when the person is getting too much nicotine, caffeine, or if it is stress induced, it is known as vasospastic Raynaud's syndrome. So another term is obstructive syndrome, obstructive Raynaud's syndrome. It is most oftenly found in association with autoimmune disorders, such as earlier we already told that there are two types. First one is primary and second one is secondary. So obstructive Raynaud's syndrome mainly depends on the secondary type, in which it is caused mainly due to the systemic lupus erythematosus, scleroderma or rheumatoid arthritis. The another causes for the Raynaud's syndrome is the use of vibrating machinery. So while the person is using vibrating instruments or such type of occupational diseases, the fingers may go into spasm. It is mainly due to the lack of or intermittent lack of blood supply to the fingers. The phenomenon, first one is the use of vibrating machinery. So with the continuous use of vibrating machinery, the fingers may go to spasm due to worsening the symptoms. Next one is emotional distress or cigarette smoking, and also some autoimmune diseases such as SLE, multiple sclerosis, fibromyalgia, some skin conditions such as psoriasis, anemia. It can also causes the Raynaud's phenomenon. underlying autoimmune disorders. So another one test is known as cold simulation test, in which the person's fingers is immersed in cold water and how much the person can tolerate the cold is measured. So the next option is digital artery pressure. So pressures are measured in the arteries of the fingers before and after the hands have been cooled. So a decrease of at least 15 mmHg is diagnostic or positive for Raynaud's phenomenon. So another one important test is Doppler ultrasound to assess the blood flow. General examinations include complete blood count, blood test for urea and electrolytes, thyroid function test, ESR and C-reactive protein, anti-nuclear antibodies. Thus it may be positive in autoimmune disorders and should be obtained in patients with features of these disorders. And rheumatoid factors, it is mainly elevated in rheumatoid arthritis and other autoimmune disorders. So next we can discuss about the complications. Complications include punctate, that is small hole lesions in the fingertips, atrophy of the skin and muscles, superficial gangrenous ulcers in advanced stages, and later stages it can lead to amputation. So conservative management. So primary focus of Raynaud's phenomenon is patient teaching. So we have to tell the patient to wear loose, warm clothing as protection from the cold, including gloves and handling cold objects and turtleneck sweaters. So fabric should be designed for cold climate should be recommended, and ask the patient to avoid temperature extremes. So immersing hands in water often decreases the vasospasm. So the patient should stop using all tobacco products, avoid caffeine, chocolates, other drugs that is having vasoconstrictive effects. Advise turning up the thermostat at home if necessary and stay out of the drafts. Teach the patient to warm up the cold car before driving so they can avoid touching the cold steering wheel or door handle, which could elicit an attack. So medical management including pharmacological therapy. So sustained release calcium channel blockers, topical nitroglycerin and IV prostanoid therapy, antibiotics, analgesics, and as possibly an endothelin receptor antagonist can manage the situation. For normal situations, the patient can take fish oil, acupuncture, and surgical management including surgical debridement of necrotic tissue, sympathectomy in advanced cases. So it is the surgical cutting of the sympathetic nerve or removal of a ganglion to relieve the condition affected by stimulation. So nursing diagnosis including ineffective peripheral tissue perfusion, anxiety, deficient knowledge, and the prevention is by stop smoking, exercises, control the stress, avoid caffeine, take care of feet and hand, and address warmly in the outdoors. So these are all about the topic Raynaud's phenomenon. Hope you should understand this topic. Thank you.